Welcome to our YouTube channel. If you're preparing for a senior healthcare assistant interview, you're in the right place. In this video, we'll be discussing some of the most common interview questions for senior healthcare assistant positions and providing you with detailed answers and tips to help you ace your interview with confidence. Whether you're a seasoned professional looking to advance your career or someone new to the field, our insights will give you the edge you need to succeed. So, grab a pen and paper, and let's dive into the world of senior healthcare assistant interview preparation. 1. Can you describe your experience working as a healthcare assistant, specifically in senior roles? My experience working as a healthcare assistant in senior roles has been both rewarding and challenging. In these positions, I've had the opportunity to take on additional responsibilities and leadership duties while still providing direct care to patients. One aspect of my role involves mentoring and training junior healthcare assistants, ensuring they understand their duties and responsibilities and providing guidance as needed. I also collaborate closely with nursing staff and other healthcare professionals to coordinate care plans and ensure that patients receive the highest quality of care. In senior roles, I often take on more administrative tasks such as managing schedules, coordinating staffing assignments, and maintaining documentation. I ensure that all regulatory requirements and quality standards are met, conducting regular audits and reviews to identify any areas for improvement. Additionally, I serve as a point of contact for patients and their families, addressing any concerns or questions they may have and advocating for their needs within the healthcare system. I prioritize building rapport and trust with patients, providing emotional support and reassurance during challenging times. Overall, my experience in senior healthcare assistant roles has allowed me to develop strong leadership skills, deepen my understanding of healthcare processes and regulations, and make a meaningful difference in the lives of patients and their families. 2. How do you handle difficult or challenging situations when providing care to patients? When faced with difficult or challenging situations while providing care to patients, I approach them with empathy, patience, and professionalism. Firstly, I prioritize understanding the root cause of the challenge, whether it's related to the patient's condition, behavior, or emotional state. Next, I employ active listening and effective communication techniques to de-escalate the situation and address the patient's concerns or needs. This involves remaining calm and composed, acknowledging the patient's feelings, and validating their experiences to establish rapport and trust. I also leverage my training and experience to employ appropriate interventions or techniques to manage the situation safely and effectively. This may involve implementing distraction techniques, utilizing calming strategies, or seeking assistance from colleagues or healthcare professionals if necessary. Furthermore, I prioritize maintaining the patient's dignity and autonomy throughout the process, respecting their preferences and choices whenever possible. I strive to empower patients to participate in their care decisions and collaborate with them to find mutually acceptable solutions. After the challenging situation has been resolved, I take time to reflect on the experience, identifying any lessons learned or areas for improvement. This reflection helps me to grow personally and professionally, ensuring that I am better prepared to handle similar situations in the future. 3. What strategies do you use to prioritize tasks and manage your workload effectively? In managing tasks and workload as a senior healthcare assistant, I employ several strategies to ensure that I can effectively prioritize and address the needs of patients and the healthcare team. Firstly, I start by assessing the urgency and importance of each task or responsibility, considering factors such as patient care needs, deadlines, and criticality. This helps me identify which tasks require immediate attention and which can be addressed later. Next, I organize tasks based on their priority and create a structured plan or to-do list to guide my workflow throughout the day. This helps me stay focused and on track, ensuring that important tasks are completed in a timely manner. Additionally, I delegate tasks when appropriate, leveraging the skills and capabilities of other team members to share the workload and maximize efficiency. Delegation not only helps distribute tasks more evenly but also fosters teamwork and collaboration among colleagues. Furthermore, I practice effective time management techniques such as setting realistic goals, breaking down tasks into smaller, manageable steps, and using tools or technology to streamline repetitive tasks or documentation. Moreover, I remain flexible and adaptable in responding to changes or unexpected situations that may arise during the day. This may involve reprioritizing tasks as needed, reallocating resources, or seeking support from colleagues or supervisors when faced with challenges or constraints. 4. Can you provide an example of a time when you had to take a leadership role within a healthcare team? There was a situation where our healthcare team was faced with a sudden influx of patients due to an unexpected emergency. As the most experienced healthcare assistant on duty, I recognized the need to take a leadership role to ensure that patient care was maintained at a high standard despite the challenging circumstances. I immediately took charge by coordinating with the nursing staff to assess patient needs and prioritize care delivery. I delegated tasks to other members of the healthcare team based on their skill sets and availability, ensuring that each patient received timely and appropriate attention. In addition to managing patient care, I provided guidance and support to less experienced team members, offering encouragement and reassurance during a stressful and demanding time. I led by example, demonstrating calmness, professionalism, and compassion in all interactions with patients and colleagues. Throughout the shift, I maintained open communication with the healthcare team, keeping everyone informed of the situation and any changes to the care plan. I facilitated collaboration and teamwork, fostering a supportive environment where everyone felt empowered to contribute to the collective effort. By taking a leadership role in this challenging situation, I was able to effectively coordinate patient care, support my colleagues, and ensure that our healthcare team remained cohesive and focused on providing the best possible care to our patients. This experience reinforced the importance of strong leadership and teamwork in delivering quality healthcare services, even in the face of unexpected challenges. 5. How do you ensure patient safety and dignity are maintained in your care practices? Ensuring patient safety and dignity is paramount in healthcare, and as a senior healthcare assistant, I prioritize these aspects in my care practices. Firstly, I maintain clear communication with patients, ensuring they understand their care plans and feel empowered to voice any concerns or preferences. I also adhere strictly to infection control protocols, including hand hygiene and proper use of personal protective equipment, to minimize the risk of healthcare-associated infections and protect patient safety. Additionally, I respect patients' privacy and dignity by maintaining confidentiality and modesty during personal care tasks, such as dressing, bathing, and toileting. I strive to create a comfortable and welcoming environment for patients, respecting their cultural, religious, and personal beliefs. Moreover, I actively listen to patients' needs and preferences, adapting my care approach accordingly to promote their autonomy and independence. To ensure patient safety, I remain vigilant for any signs of deterioration in patients' health or changes in their condition, promptly escalating concerns to healthcare professionals for further assessment and intervention. I also conduct regular checks of patient environments, ensuring they are free from hazards and obstacles that could pose a risk to patient safety. 6. How do you handle conflicts or disagreements with colleagues or patients? Handling conflicts or disagreements with colleagues or patients requires a calm, empathetic, and solution-focused approach. With colleagues, I prioritize open communication and active listening to understand their perspectives and concerns fully. I aim to address conflicts promptly and directly, seeking to find common ground and resolve issues collaboratively. I emphasize mutual respect and professionalism, focusing on finding win-win solutions that benefit both parties and the overall team dynamic. When conflicts arise with patients, I approach the situation with empathy and compassion, recognizing that their well-being is paramount. I listen attentively to their concerns and validate their feelings, demonstrating understanding and empathy. I aim to de-escalate the situation by remaining calm and reassuring, offering support and assistance to address their needs effectively. In both cases, I strive to maintain professionalism and respect for all parties involved, focusing on finding constructive solutions and fostering positive relationships. I am proactive in addressing conflicts as they arise, seeking to prevent escalation and minimize any negative impact on patient care or team dynamics. 7. What measures do you take to stay updated on current healthcare practices and guidelines? To stay updated on current healthcare practices and guidelines, I employ several key measures. Firstly, I actively participate in ongoing training and continuing education opportunities provided by my employer or professional organizations. This may include attending workshops, seminars, or conferences related to healthcare practices, safety protocols, and emerging trends in the field. Additionally, I regularly review reputable healthcare publications, journals, and online resources to stay informed about the latest research findings, best practices, and guidelines relevant to my role. These sources provide valuable insights into advancements in healthcare technology, treatment modalities, and patient care approaches. I also engage in peer networking and collaboration with colleagues and healthcare professionals, exchanging knowledge, experiences, and best practices. This enables me to learn from others' experiences and perspectives, gain new insights, and stay abreast of industry trends and developments. Furthermore, I actively seek feedback from supervisors, mentors, and other healthcare professionals to identify areas for improvement and opportunities for growth. By soliciting input from trusted sources, I can refine my skills, enhance my knowledge, and adapt to evolving healthcare practices and guidelines. 8. Describe a situation where you had to provide emotional support to a patient or their family members. In my role as a senior healthcare assistant, I encountered a situation where a patient receiving long-term care experienced a significant decline in their health, leading to emotional distress for both the patient and their family members. The patient, who had been battling a chronic illness, experienced a sudden deterioration in their condition, which resulted in increased pain and discomfort. This not only impacted the patient's physical well-being but also took a toll on their emotional and mental health, leading to feelings of anxiety, fear, and helplessness. Recognizing the importance of providing emotional support in such a challenging time, I took a proactive approach to engage with both the patient and their family members. I spent time listening to their concerns, validating their emotions, and offering reassurance and empathy. For the patient, I provided companionship and comfort, offering a compassionate presence and lending a listening ear to their fears and worries. I encouraged them to express their feelings openly and provided encouragement and support to help them cope with their situation. For the family members, I offered information and guidance about the patient's condition, treatment options, and available support services. I listened to their concerns and provided emotional support, acknowledging the difficulty of their situation and offering practical assistance where possible. Throughout the process, I maintained open and honest communication with both the patient and their family members, keeping them informed about the patient's condition and involving them in decision-making regarding their care. By providing compassionate and empathetic support to the patient and their family members during this challenging time, I helped alleviate their emotional distress, fostered a sense of connection and understanding, and contributed to their overall well-being and comfort. 9. How do you approach patients with diverse cultural backgrounds or communication needs? Approaching patients with diverse cultural backgrounds or communication needs requires a personalized and empathetic approach to ensure that each individual receives culturally sensitive and effective care. Firstly, I prioritize building rapport and establishing trust with the patient by demonstrating respect for their cultural beliefs, customs, and preferences. I take the time to learn about the patient's cultural background, including their language, traditions, and values, which helps me adapt my communication style and approach accordingly. Next, I use effective communication strategies to bridge any language or cultural barriers that may exist. This may involve using interpreters or translation services to facilitate clear and accurate communication, ensuring that the patient fully understands their care plan, treatment options, and any instructions or recommendations provided. Additionally, I pay attention to nonverbal cues and body language, which can convey important information in cross-cultural interactions. I remain attentive and observant, tuning into the patient's emotions and expressions to better understand their needs and concerns. Furthermore, I involve family members or support networks in the care process, recognizing the importance of familial and community involvement in many cultural contexts. By engaging family members as partners in care, I can ensure that the patient receives comprehensive support and advocacy. Overall, my approach to patients with diverse cultural backgrounds or communication needs involves respecting their cultural identity, using effective communication strategies, being attentive to nonverbal cues, and involving family members or support networks as appropriate. By prioritizing cultural sensitivity and effective communication, I strive to provide patient-centered care that respects the individuality and dignity of each patient. 10. Can you give an example of a time when you advocated for a patient's needs? One notable instance where I advocated for a patient's needs was when I noticed a discrepancy in a patient's care plan that had the potential to impact their well-being. The patient, who had recently undergone surgery, was scheduled to receive a specific medication as part of their post-operative care. However, upon reviewing the medication administration record, I discovered that the dosage prescribed was significantly higher than what was recommended for the patient's age and medical history. Recognizing the potential risk associated with administering the incorrect dosage, I immediately brought this issue to the attention of the nursing team and the healthcare provider responsible for the patient's care. I explained my concerns regarding the dosage discrepancy and emphasized the importance of ensuring the patient's safety by administering the appropriate medication dosage. I advocated for the patient by advocating for a review of the care plan and medication orders to ensure they aligned with the patient's specific needs and medical condition. I provided relevant information and evidence to support my concerns, such as the patient's medical history and recommended dosage guidelines. As a result of my advocacy efforts, the healthcare provider reviewed the medication orders and confirmed that an error had indeed occurred. The dosage was adjusted accordingly, and the patient received the appropriate medication without any adverse effects. My proactive approach to advocating for the patient's needs helped prevent potential harm and ensured that the patient received safe and effective care. 11. How do you ensure effective communication with non-English speaking patients? Ensuring effective communication with non-English speaking patients is essential for providing quality care and promoting patient safety and satisfaction. My approach involves several strategies to overcome language barriers and ensure that patients understand their care plan and feel supported throughout their healthcare journey. Firstly, I utilize professional interpretation services whenever possible to facilitate communication with non-English speaking patients. This may involve employing qualified interpreters, either in person or via telephone or video conferencing, who can accurately translate conversations between healthcare providers and patients. In situations where professional interpreters are not available, I utilize alternative communication methods, such as written materials in the patient's preferred language or utilizing translation apps or software to facilitate basic communication. Additionally, I prioritize nonverbal communication techniques, such as gestures, facial expressions, and body language, to convey empathy, reassurance, and understanding. I speak slowly and clearly, using simple language and avoiding medical jargon to ensure that the patient can understand me to the best of their ability. I also involve family members or friends who may be able to assist with interpretation, ensuring that the patient feels supported and included in their care decisions. Overall, my goal is to ensure that non-English speaking patients receive the same level of care and attention as all other patients, regardless of language barriers. I strive to create a supportive and inclusive environment where all patients feel heard, understood, and valued. 12. Can you describe your experience with assisting in patient assessments? My experience with assisting in patient assessments has been extensive and multifaceted. As a senior healthcare assistant, I have played a crucial role in supporting healthcare professionals in conducting comprehensive assessments of patients' physical, emotional, and cognitive status. Firstly, I collaborate closely with nurses, physicians, and other members of the healthcare team to gather relevant patient information, including medical history, vital signs, and symptoms. I assist in performing physical examinations, such as measuring blood pressure, pulse, temperature, and respiratory rate, and recording accurate and detailed observations for documentation. Additionally, I help patients with activities of daily living ADLs during assessments, ensuring their comfort and safety while providing assistance with mobility, personal hygiene, and nutritional needs. I also facilitate communication between patients and healthcare professionals, advocating for patients' needs and preferences throughout the assessment process. Furthermore, I am trained to use specialized equipment and tools to assist in patient assessments, such as electrocardiogram ECG machines, oxygen saturation monitors, and glucometers. I ensure that these devices are properly calibrated and functioning correctly to obtain accurate assessment data. 13. What steps do you take to promote dignity and respect for patients? In my role as a senior healthcare assistant, promoting dignity and respect for patients is paramount in delivering compassionate and person-centered care. Firstly, I approach each interaction with empathy, compassion, and a non-judgmental attitude, recognizing the unique needs, preferences, and experiences of each patient. I take the time to listen actively to their concerns, validate their feelings, and involve them in decisions about their care whenever possible. Additionally, I prioritize maintaining privacy and confidentiality at all times, respecting the patient's right to confidentiality and ensuring that sensitive information is handled with discretion and professionalism. Furthermore, I promote autonomy and independence by empowering patients to make informed decisions about their care and respecting their choices, preferences, and cultural or religious beliefs. I involve them in discussions about their treatment options, goals, and preferences, and support them in advocating for their own needs and rights. Moreover, I foster a supportive and inclusive environment that values diversity and recognizes the inherent worth and dignity of each individual, regardless of their background, abilities, or circumstances. I treat patients with kindness, courtesy, and respect, and I encourage colleagues to do the same. 14. How do you handle situations where a patient is non-compliant with treatment plans? When faced with a situation where a patient is non-compliant with their treatment plan, I approach it with empathy, understanding, and a commitment to finding a solution that best meets the patient's needs. Firstly, I take the time to listen to the patient's concerns and reasons for non-compliance without judgment, recognizing that there may be underlying factors contributing to their behavior. Next, I provide education and information about the importance of adhering to the treatment plan, explaining the potential risks and benefits in a clear and understandable manner. I address any misconceptions or fears the patient may have, and I work collaboratively with them to identify any barriers or challenges they are facing in following the treatment plan. I also involve other members of the healthcare team, such as nurses, physicians, or social workers, to provide additional support and resources to address the patient's needs. Together, we explore alternative approaches or modifications to the treatment plan that may better align with the patient's preferences, lifestyle, or circumstances. Throughout the process, I remain patient and supportive, offering encouragement and reassurance to the patient as they work towards achieving their health goals. I emphasize the importance of open communication and ongoing dialogue, encouraging the patient to express any concerns or questions they may have along the way. Ultimately, my goal is to empower the patient to take an active role in their healthcare journey and to collaborate with them in finding solutions that promote their overall well-being. By approaching non-compliance with empathy, understanding, and collaboration, I aim to support the patient in achieving optimal health outcomes while respecting their autonomy and dignity. 15. Can you provide an example of a time when you had to handle an emergency situation? One memorable instance where I had to handle an emergency situation occurred during a night shift at the healthcare facility where I worked. I was responsible for overseeing the care of several patients when suddenly an elderly patient experienced a sudden cardiac arrest. Without hesitation, I immediately activated the emergency response protocol, calling for assistance from the nursing team and initiating CPR cardiopulmonary resuscitation on the patient. While performing chest compressions, I calmly directed other staff members to retrieve the automated external defibrillator aid and contact the on-call physician for further instructions. As the situation unfolded, I remained composed and focused, providing clear and concise communication to ensure a coordinated response from the healthcare team. I continued CPR until the aid arrived, at which point we promptly administered a shock to the patient's heart in an attempt to restore normal cardiac rhythm. Throughout the emergency, I ensured that the patient's airway remained clear and vital signs were monitored closely. Despite the challenging circumstances, I remained vigilant for any changes in the patient's condition, adjusting our interventions accordingly to optimize their chances of survival. Fortunately, our efforts paid off, and the patient's heartbeat was successfully restored after multiple rounds of CPR and defibrillation. The patient was stabilized and transferred to the intensive care unit for further management and monitoring. Reflecting on this experience, I recognized the importance of remaining calm under pressure, acting swiftly and decisively in emergencies, and working collaboratively as a team to provide the best possible care to patients in critical situations. 16. How do you maintain patient confidentiality and privacy in your work? Maintaining patient confidentiality and privacy is crucial in my role as a senior healthcare assistant. I follow strict protocols and guidelines to ensure that patient information is protected at all times. Firstly, I adhere to legal and organizational policies such as GDPR, General Data Protection Regulation. These regulations provide a framework for handling patient information securely and confidentially. I ensure that patient records, whether electronic or paper-based, are securely stored and only accessible to authorized personnel. This includes using password-protected systems for electronic records and locked cabinets for physical documents. I never leave patient information unattended or in areas where unauthorized individuals could access it. During interactions with patients, I am mindful of privacy, conducting conversations in private settings where others cannot overhear sensitive information. I avoid discussing patient details in public areas or with individuals who do not have a legitimate need to know. When sharing patient information with other healthcare professionals, I do so only on a need-to-know basis and through secure communication channels. I verify the identity and authorization of individuals before disclosing any information to ensure that it is shared appropriately and securely. I also educate and remind colleagues about the importance of maintaining confidentiality and privacy, fostering a culture of respect and vigilance around patient information. 17. What do you consider to be the most challenging aspect of working as a senior healthcare assistant? The most challenging aspect of working as a senior healthcare assistant is balancing the emotional and physical demands of the job while maintaining high standards of care. Dealing with patients who are often in pain, distressed, or experiencing significant health issues requires a great deal of empathy and emotional resilience. This emotional toll can be challenging, as it is essential to provide compassionate care without becoming overwhelmed by the situations of individual patients. Additionally, the physical demands of the job can be strenuous. Assisting patients with mobility, personal hygiene, and other activities of daily living often involves lifting, transferring, and standing for long periods. This requires maintaining personal physical health and stamina to prevent injury and ensure that I can provide continuous support to patients. Another challenge is staying updated with constantly evolving healthcare practices, guidelines, and technologies. It requires continuous learning and adaptation to new methods and protocols, which can be demanding but is crucial for providing the best care possible. 18. How do you ensure a smooth transition of care when handing over responsibilities to other healthcare professionals? Ensuring a smooth transition of care when handing over responsibilities to other healthcare professionals involves clear, comprehensive communication and thorough documentation. Firstly, I prepare detailed handover notes that include the patient's current condition, medical history, treatment plans, medications, and any recent changes or concerns. This documentation is precise and up-to-date to ensure the receiving healthcare professional has all necessary information. During the handover meeting, I communicate this information verbally, highlighting any critical details or urgent issues that require immediate attention. I make sure to address any questions or concerns the receiving professional may have to ensure clarity and understanding. Additionally, I prioritize the timing of the handover to avoid disruptions in patient care. I aim to conduct handovers at designated times when the receiving professional can fully engage in the process without distractions. To further ensure continuity, I remain available for follow-up questions or clarifications after the handover. This open line of communication helps address any issues that may arise and supports the ongoing care of the patient. 19. Can you discuss a time when you had to adapt to unexpected changes or challenges in your role? There was a time when our healthcare facility experienced a sudden outbreak of a contagious illness, leading to an unexpected influx of patients requiring immediate care and isolation measures. As a senior healthcare assistant, I had to quickly adapt to this challenging situation to ensure patient safety and maintain quality care. Firstly, I took swift action to implement the facility's emergency protocols. This involved setting up isolation areas, coordinating with the nursing staff to manage patient flow, and ensuring that all necessary protective equipment and sanitation measures were in place. I provided clear instructions and support to my colleagues, emphasizing the importance of strict adherence to infection control procedures. Simultaneously, I communicated effectively with patients and their families, offering reassurance and clear information about the steps being taken to protect their health. I listened to their concerns and answered their questions, providing a calm and composed presence during a stressful time. To manage the increased workload, I prioritized tasks based on urgency and delegated responsibilities to other team members, leveraging their strengths and skills. I also collaborated with other departments and healthcare professionals to coordinate care and resources effectively. Throughout the crisis, I remained flexible and responsive to the evolving situation, continuously assessing and adjusting our approach as needed. My ability to adapt quickly and lead the team through the unexpected challenge ensured that we maintained a high standard of care and patient safety despite the difficult circumstances. 20. How do you motivate and support junior healthcare assistants in their professional development? As a senior healthcare assistant, motivating and supporting junior healthcare assistants in their professional development is a key responsibility. I prioritize creating a positive and collaborative work environment where junior staff feel valued and encouraged to grow. I begin by setting a good example through my own work ethic, professionalism, and dedication to patient care. I actively engage with junior healthcare assistants by offering guidance and sharing my knowledge and experience. During shifts, I provide hands-on training and practical demonstrations, ensuring they understand various procedures and protocols. I also encourage them to ask questions and discuss any concerns they might have. To support their development, I regularly provide constructive feedback, highlighting their strengths and identifying areas for improvement in a respectful and encouraging manner. I emphasize the importance of continuous learning and professional growth, suggesting relevant training programs, workshops, and courses that can enhance their skills and knowledge. Additionally, I facilitate opportunities for junior healthcare assistants to take on more responsibilities gradually, helping them build confidence and competence in their roles. By fostering a supportive environment, I ensure they feel comfortable seeking advice and support when needed. Here are 10 tips to help you pass your senior healthcare assistant interview. 1. Understand the role. Familiarize yourself with the responsibilities and expectations of a senior healthcare assistant. Know the skills and attributes that are crucial for the position, such as compassion, attention to detail, and teamwork. 2. Review common interview questions. Prepare for common interview questions related to healthcare, such as patient care scenarios, handling difficult situations, teamwork, and communication. Practice your responses to these questions. 3. Showcase your experience. Highlight your relevant experience, especially any previous roles in healthcare. Discuss specific examples where you demonstrated your skills and contributed to patient care and team success. 4. Emphasize patient care. Demonstrate your commitment to providing high-quality patient care. Share examples of how you've gone above and beyond to ensure patients' comfort, dignity, and well-being. 5. Highlight soft skills. Emphasize important soft skills such as empathy, communication, problem-solving, and the ability to work under pressure. Provide examples of how you've used these skills in your previous roles. 6. Prepare questions. Have a few insightful questions ready to ask the interviewer about the facility, team, or specific expectations for the role. This shows your interest and engagement. 7. Be familiar with policies and procedures. Understand basic healthcare policies, procedures, and regulations, including patient privacy, infection control, and emergency protocols. 8. Show adaptability. Highlight your ability to adapt to different situations and challenges in a healthcare setting. Share instances where you had to adjust quickly to new circumstances or unexpected changes. 9. Demonstrate teamwork. Discuss your experience working in a team environment. Provide examples of how you've effectively collaborated with colleagues, supported team members, and contributed to a positive team dynamic. 10. Be professional and personable. Present yourself professionally, but also show your personable side. Healthcare is a people-centric field, so demonstrating both professionalism and a caring attitude can make a strong impression. By following these tips, you'll be well prepared to demonstrate your qualifications and passion for the senior healthcare assistant role, increasing your chances of success in the interview. Good luck! Thank you for watching our guide on senior healthcare assistant interview questions and answers. We hope you found the information valuable and insightful as you prepare for your interview. Remember, preparation, confidence, and a genuine passion for patient care are key to success in this role. If you found this video helpful, please like, share, and subscribe for more career tips and guides. Good luck with your interview, and we wish you all the best in your journey as a senior healthcare assistant. Until next time, take care and keep striving for excellence.